Rethinking efficiency. Visalys Bulk Fill for long-lasting posterior restorations. A very warm welcome to all of you watching this new series on Kettenbach Dental about the new Visalys Bulk Fill. I hope you enjoy the upcoming session. My name is Maximilian Dobbertin. I'm a dentist from Frankfurt, Germany, and I'm a speaker for Kettenbach Dental in the field of restorative dentistry. As you can see here, I brought you a couple of pictures and case reports. We will be going to discuss a little bit more in depth. Now, as we can see here, a initial X-ray of the posterior molar region. We have quite a large cavity on tooth number 36, which then leads to a direct restorative procedure. Obviously, as we have seen already, direct restorative procedures depend a lot on the workflow, on isolation techniques and the conditioning of the surfaces, such as the immediate dentine sealing technique. We'll be talking about that shortly. As you can see here in those initial pictures after the isolation protocol, including a cord and a isolation system as the rubber dam, I chose the BioClear matrix system. As you can see here, this little probe where you can measure your depth of the cavities and the angulation design, so to better choose the correct matrix in terms of how bulky, how round the structure of the matrix system should be. As you can see here in the right picture, isolation is still not working 100% as I could then be satisfied. So additionally to this, the rubber dam has to be inverted. It has to be tucked in between the gums and the root, then the tooth. And after that, still working with a ligature out of dental floss to secure the rubber dam in the depth and to enable a correct and precise fitting of the matrix system, as you can see here. So the matrix system then should adapt correctly to the margins of the restorations, especially the most cervical, the most apical margins, to enable a sufficient isolation protocol so that the margins are adapted perfectly. As you can see here, also the preparation design of the cavity, the class 2 cavity, should be clear, so it should deliver a well overview so that we can see every single detail all the time, because only what we can see, that is what we can treat later on. Comparing dentine and enamel structures, we obviously want the outer layers of enamel to be a little bit matte, opaque in their structure, so that we can ensure that the isolation protocol has worked sufficiently. The enamel is totally dry, but regarding to this, the dentine parts of the tooth could have still a little more viscosity, a little bit more wetness on there, just to be sure that the collagenous fibers do not collapse. As you can see here, this is quite a deep carious lesion. This is somehow a indirect capping, not using any kind of MTA or calcium hydroxide, just capping this with a flowable and then doing the layering procedure with the newly released Visalys Bulk Fill from Kettenbach. As you can see here, this is a partial matrix system which is used for single contact treatments only. So the best possible way to restore a contact point, which then leads to a strong contact point design. The overall result showing on the right side shows us that the margins, the adaptation in terms of marginal integrity, but also color integrity is on a very good point. So we can be happy only using single shade composites in such treatments because they are not that highly aesthetic demanding, but still this is quite an aesthetic result. And of course, just to check the restoration later on, we need to be sure that our work is of good quality, and to ensure this we can do a post-op X-ray just to check the margins, the adaptation, the density, structure, the radio opacity of this material then actually delivers quite a good result, because we can see a lot of contrast in between the restoration and the tooth itself, which then leads to better diagnosis. A important point about the usage of bulk fills, as I said before, is time savings. When we use the increment thickness up to 4 or maybe 5 millimeters instead of 2 millimeters, we can work more efficient, more effectively. We need a shorter treatment time because of using less layers, but on the other hand, reducing time also sometimes reduces possible errors, because time is always working against us in terms of isolation protocol. We want to be sure that our treatment is as precise as possible, and when we can work a little faster because the material allows us, then we can work against the time and do not have the time working against us. Particularly relevant is this technique within the fields of pediatric dentistry, uncooperative or restless patients, but also extensive posterior restorations. A major advantage of this whole system, the bulk fill composites, is the reduced polymerization shrinkage, and with that a reduced shrinkage stress. Using modified monomer systems within those bulk fill composites enables us to fill larger cavities at the same stage, at the same time. So the risk of a secondary caries is way lower than with incremental techniques, because using more layers also produces more potential errors. The post-operative sensitivity is also a lot less in bulk fill composites, and that is not only because of the reduced polymerization shrinkage, but mainly also because of the improved light transmission, and with that the better polymerization depth. And with that, talking about the improved light transmission, we obviously have composites that are a little more translucent than, for example, once you layer and you use dentine composites. They're quite opaque in comparison to that. Sometimes bulk fill composites, such as this particular one, do a little bit of a color shift within the polymerization, which means that initially it is a little more translucent to enable better light transmission, and with polymerization the arrangement of fillers and particles within that system then after all blocks out a little bit of light to gain more opacity and more of that opalescence dentine effect, so that the restoration can actually look quite natural. Obviously, a composite which is a single shade composite and a bulk fill composite has always a simplified handling. Less techniques, less layers, then enables us to be more precise on the modeling area and step a little bit back from the issues of layering increments and potential irregularities. So with that, it is definitely lower technique sensitive, and we have less errors in terms of what can happen with using increments. On the other hand, the mechanical stability is as good as conventional composites. We have high flexural strength. We have obviously a very good wear resistance in the posterior regions, especially bulk fill composites. Usually, no matter what manufacturer, are developed for posterior regions, for regions where light is a little bit more tricky to be placed on the cavity and on the restoration. Situations which are a little bit trickier to isolate. Always, this is the right indication to use bulk fill composites, because then we are on the safer side. We can work smoother and more predictable. Here I have another little case for you, which is a child. So we have primary teeth in this case with a little cavity in the lower primary molar region. Obviously, this is something which can be a little bit painful for kids. Obviously also the use of materials that might tend to elongate the restorational procedure can limit us, but also the patient within the treatment. So we always want to be most effectively when treating kids or younger patients, but also those patients who suffer because of anxiety. So we want to be on the very precise side. We have a little bit of a caries here, and then we do the isolation protocol with rubber dam and a ligature. In this case, the cavity is not that very deep, but still a very good isolation protocol is always necessary. We have the use of the caries detector to ensure we remove all the caries, so there is no risk of a caries recidivate or a secondary caries. This is a situation where the cavity is primary preparated after the caries detector, and with that we still see a little bit of work has to be done there, especially on the margins and in the central dentin. But looking from the side, we also see that the very posterior tooth also got a little bit of a decay on the mesial side. So I decided to treat this in the same session to be on the safe side, that no further cavity happens in this area. So this is the final preparation, the secondary preparation, where the margins are opened so that the matrix can be placed very, very easily in there. We always want to ask us what cavity we design first. So obviously the mesial cavity on the lower primary tooth number 5 has to be done first, because it is easier. We can do this quietly freehand technique, and then only using the matrix system, the partial matrix system, for the lower primary tooth number 4 in this case. And here you can see the final restoration with the transitional lines and the marginal ridges and ledges on the same height, so there's no risk of a pre-contact. We have a little bit of a color mismatch. The restoration itself looks a little bit more dentine-like. The teeth themselves are a little bit dehydrated in this case because of the usage of the rubber dam. but when we take the rubber dam away and polish everything, there's some kind of a re-wettening and a rehydrating of the surfaces, and after that we will definitely see that the color is identically. And as we can see here, this is the situation after removing the rubber dam and polishing everything to a high gloss. Even in this stage, we don't see any differences in color or in shade. We have a very good marginal integration of these restorations. Contact point design is on point. There's not too much pressure on the distal ledge, so we can be very happy to have a restoration like this. And this is the situation after removing the little blue spots of the occlusion foil. The indications for using a bulk fill composite such as the Visalys Bulk Fill from Kettenbach is definitely direct posterior restorations. I personally try to use bulk fill restorations in those cases where I have problems with isolation, but I definitely need to isolate on a very good point. But sometimes even saliva, liquid, blood, etc. Can penetrate the matrix system or the rubber dam with time. So in those cases, I need to be very time efficient and not that time consuming. So I try to use bulk fill composites. Especially in class 1 restorations, bulk fill composites always work very well because the color adaptation is very, very good in these cases because we have surrounding margins. So the light transmission through the bulk fill composite and towards the tooth and reflecting is the best possible way. For class 2 restorations, it sometimes depends on where they are located. In the molar regions, I totally find that very satisfying to use bulk fill composites. In further anterior restorations, premolar restorations on the mesial side, I personally think that sometimes a layering technique can still be more aesthetical, but on the other hand, most of the patients, they do not really care about that kind of aesthetical difference. So definitely, as you can see here with the primary tooth restoration on the child, the aesthetical outcome of the Visalys Bulk Fill is right on point, very, very well. But obviously in deep cavities with high C-factor problems, high shrinkage, bulk fills are more and more demanded by dentists. So it is nothing that we can't forget about in direct restorative procedures nowadays. Furthermore, it is something that we definitely need as dentists. The indication of pediatric dentistry is because of such treatments are quite critical in timing. Children or kids, they do not want to sit on a dental chair for such a long time. They do not want to feel any pressure. They don't want to feel uncomfortable, and the better our workflow is and more effective in terms of time management, the better it is for every one of us. MIH, so molar incisor, hypomineralizational restorations, they also can be restored with bulk fill composites, especially in the posterior region. There we have to be sure that the retention profile on the tooth, so the microstructure, is good enough. So we need a good preparation or combining this with a aluminum oxide sandblasting, so air abrasion, and then a good etching and adhesive protocol, obviously. Other indications, as we have seen already, is economically orientated practice concepts, where we have patients that cannot afford very, very high quality dentures. so that we can have still the posterior composite restoration as a possibility to restore those teeth with, and do not always have to do anything with ceramics. It is for optimizing chair time, so with better time management we obviously have a better ratio of salary or honorarium towards a restoration. Also, for base techniques and lining techniques, bulk fill composites are very well to use. I personally like to use the Visalys Bulk Flow for such lining techniques, because with a flowable I can be also a lot faster and a little bit more controlled towards the surface adaptation. And then for occlusive capping, this is definitely something I try to do with the Visalys Bulk Fill. Also, clinical practical tips for the application is to use a light polymerization method with a lamp producing more than 1000 milliwatt per square centimeter, because then we can enable that the light transmission and the energy transmitted is the best possible, because when with a polymerization the material does a little bit of a light shift and a colored shift, an opacity shift, which then leads to a reduced penetration of light through the restoration. So the position of the light is also very important, to be from a right angle straight toward the surface of the restoration, and then of course the time of or the period of time used for the polymerization should also be on the sufficient side, so at least 20 seconds when finishing the restoration, so that a final curing, a total depth curing can be enabled. As the clinical practical tips for application are a very strong key factor in the step-by-step protocol, the adhesive technique is something which is not to be underestimated. With the adhesive technique, we ensure a correct bonding and a maximum strength of the restoration towards the tooth, and it is not even a substitute for a proper adhesive strategy. More or less, it is selective enamel etching is often advisable, but even a total etching system can be sometimes even better in terms of cleaning the overall surface from the debris and the smear layer. The absolute and the relative isolation in this case is something which is very important to ensure that there is no kind of leakage. And then we have to consider the aesthetics, even in bulk fill composites. And due to higher translucency, those bulk fill composites sometimes have a little bit of a grayish effect, or may occur in very thin areas where they meet the enamel, but this is not the fact within the newly released Visalys Bulk Fill, as you will see in the following cases. So for high aesthetic demands, sometimes it can be useful to do an occlusal capping layer in terms of more individualization for this specific restoration. Here you can see quite a deep class 2 cavity, quite a deep decay, which then has to be excavated, obviously, using a absolute isolation technique with rubber dam and a clasp, and even using caries detector, as you can see here, the greenish color, to ensure that the cavity is fully caries free. After that, after cleaning the cavity also with aluminum oxide sandblasting, so air abrasion, we can ensure that all the surfaces are nice and smooth and can be connected to the adhesive protocol in the best way possible. This is what you can see here, the situation after the final preparation and the sandblasting of the surfaces. And after that, we need to ensure a proper fit of the matrix system. In this case, it is a partial matrix system for this distal part to ensure that all the margins are correctly sealed. And after that, because we are using a bulk fill composite, the layering protocol is mostly done all in one to ensure a proper modeling of the restoration, but also a very tight fit of the marginal gaps. This is the situation right after the modeling of the class 2 cavity, occlusal and distal, designing a nice distal enamel ledge, roundish contours, so there is no strong wear behavior over any edges or visible margins. After that, this has again to be polished and reworked for the occlusal contact point design, and as you can see in the following picture, this is the situation straight after removing the rubber dam. We have quite nice aesthetics in this distal zone. We have functional contact points, we have a good occlusal loading, and even if in the post-op x-ray this can be determined that all the margins are totally fine sealed. As you can see here, the radial opacity of this specific material is very nice to have a clear view and contrast regarding to the tooth structure itself, and to ensure that there are no marginal gaps and everything is finely sealed. The use of bulk fill composites is increasingly being discussed in pediatric dentistry, particularly in the treatment of carious lesions in primary teeth. Shortened treatment times and a simplified clinical procedures are of great importance. Due to their greater depth of cure, bulk fill composites allow placement in thicker increments and can therefore simplify and accelerate restorative treatment. However, the question remains whether these materials can also provide sufficient marginal integrity in primary teeth, since marginal adaptation is a decisive factor for the long-term clinical stability of a restoration. This question was investigated by Pagianini, Attin and Tauberg in a study published in 2020 in the Journal of Materials. The aim of the study was to analyze whether bulk fill composites used in class 2 restorations of primary teeth achieve marginal quality comparable to that of conventional composites placed using the traditional incremental layering technique. The authors sought to determine whether the simplified application technique of bulk fill materials might affect the marginal integrity of the restoration. The results of the study showed that the bulk fill composite can achieve good marginal adaptation in primary teeth. Overall, the measured marginal integrity was comparable to that of conventional composite restorations placed using the classical layering technique. Both before and after artificial aging, no clinical relevant differences in marginal quality were observed between the investigated restorative approaches. At the same time, the study confirmed that thermal and mechanical stresses, such as those occurring in oral cavity, can generally lead to some reduction in marginal integrity regardless of the material used. The authors interpreted these findings to suggest that bulk fill composites may represent a valid restorative option in pediatric dentistry. The simplified amplification technique does not appear to negatively affect the marginal integrity of the restoration, especially in the context of treating children where minimizing treatment time is often crucial. This may represent a significant clinical advantage. In summary, this study demonstrates that bulk fill composites used in Class 2 restorations of primary teeth can achieve marginal integrity comparable to that of conventional composite restorations. These findings therefore support the clinical use of the materials in pediatric dentistry, particularly when a simplified and time-efficient restoration technique is desired. And as you can see here, this is a primary tooth decay treatment case where the caries lesion is already quite deep, also visible in the preoperative X-ray. After that, we always try to do an absolute isolation protocol as we do it in adult teeth. Sometimes this is not possible with children, but if it's possible, it should be recommended. Then this is the situation after placing the rubber dam and the clamp, and we can obviously see the quite deep decay. After fully removing the caries lesion, we then can apply the etching protocol, the adhesive system, and after that even the Visalys Bulk Fill composite restoration. This is the situation after the etching, and after that we need to do the adhesive system. As this specific tooth doesn't have any proximal contact points towards the mesial side, we don't need to use a matrix system at all. This restoration is totally done in a freehand style technique to be sure to work as efficient and as fast and as precise as possible. Then after the placing of the composite, this has to be fully cured and contact points have to be checked and polished. And as you can see here, the integrity of the tooth and the restoration is totally fine. Aesthetics are also in a very high class way for a bulk fill composite, and the patient can be happy to have this tooth for a couple of years more until the adult tooth is erupting. For a long time, the clinical evaluation of bulk fill composites has been based primarily on laboratory studies. However, for clinical decision making in vivo, data on long-term performances are particularly important. This is precisely the focus of the systematic review by Sara Pulseva and colleagues, published in the Dentistry Journal in 2025. The aim of this work was to systematically summarize the available clinical evidence regarding the performance of bulk fill composites compared with a classical incremental layering technique, specifically in primary teeth. The central research question addressed by the authors was whether bulk fill composites demonstrate clinical performance comparable to that of conventional composites placed incrementally in restorative treatments of primary teeth. And as we have seen before in other studies, this definitely works. So the aggregated results show no significant clinical difference between bulk fill composites and conventional incrementally placed composites in the restorative treatment of primary teeth. Bulk fill materials demonstrate comparable results in terms of both retention rates and restoration survival probability. Likewise, no consistent disadvantages of the bulk fill techniques were identified regarding marginal integrity. At the same time, the authors point out that the quality of the available evidence remains partially limited, so we still have to do a lot more studies on this topic. And as you can see here, back to an adult teeth, also in cavities that are a little bit discolorated, Bulk fill composites such as the Visalys Bulk Fill may work quite on an aesthetically high demanding way. So as we can see here, this is some kind of a class 5 lesion, a buccal lesion. And isolating this properly with rubber dam and a clamp, we can then assure to place the bulk fill composite restoration most effectively and most efficiently without any hazards of leakages. And as you can see here, there's a little bit of discoloration from the inside of the tooth, which is totally fine. And the combination of both the discoloration, the color of the tooth itself, combined with the translucent and somehow light effects of the bulk fill composites then can lead to a natural looking result, as you can see here. And even after taking out the rubber dam, this is quite an aesthetic result for only using one shade in quite a limited way, other than having more shades in an incremental technique using conventional composites. With Visalys Bulk Fill, Kettenbach Dental introduces a packable bulk fill composite that meaningfully expands its existing product line. Developed for posterior restorations, the material combines efficient single-layer application with inherent material stability, addressing key requirements in everyday clinical practice. With the introduction of Visalys Bulk Fill, Kettenbach Dental continues to systematically expand its modular bulk system. In combination with the flowable Visalys Bulk Flow, users have access to a coordinated system that provides suitable solutions for both cavity basis and definitive restorations. This allows for flexible implementation of individualized treatment concepts, ensuring efficient workflows and reliable results in daily practice. A key feature of Visalys Bulk Fill is its very low water absorption. This property significantly contributes to the long-term stability of the restoration, as it reduces the risk of marginal changes and supports the integrity of the filling over time. Combined with high abrasion resistance, this creates a reliable foundation for durable posterior restorations. Visalys Bulk Fill enables fast and safe single-layer application of up to 4 mm. This reduces treatment steps and streamlines workflows. Low polymerization shrinkage stress supports stress-reduced curing, while excellent sculptability allows precise adaptation to the cavity. This facilitates both direct clinical use and the implementation of complex restorative concepts. The one-shade concept ensures harmonious integration with the natural tooth structure, as you have seen in the cases, and enables aesthetically pleasing results without time-consuming shade selection. At the same time, the material offers a broad range of indications, from class 1 to class 5 restorations, pediatric fillings to core buildups. With Visalys Bulk Fill, Kettenbach Dental expands its portfolio with a high-performance bulk fill composite that stands out in particular for this material stability, handling efficiency, and even aesthetic potential. The one-shade system allows users to rediscover how aesthetic a bulk fill composite can be. Thank you very much for your attention. I hope you enjoyed this broad overview around the world of bulk fill composites and even taken a look into the newly developed and newly released material from Kettenbach, Visalys Bulk Fill.